All right, should we get started? People are going to keep trickling in, especially as they hop off gather. But you ready, Gillian? Should we get the show on the road?
Shall we?
All right, let's do it. Well, maybe we should just reintroduce ourselves just in case anyone missed the opening plenary. My name is Benjamin Day. I'm the executive director of Healthcare Now.
And I am Gillian Mason, and I'm the communications director of Healthcare Now.
And that means you are looking at all of Healthcare Now. We are a two-staff person national Medicare for All organization. But this conference is one of the big things we do every year that we host. So we were kind of the conference organizers. And we wanted to just close with a couple of things. First, there's a couple of logistics notes. We've been getting this question a lot. Every single plenary in the week leading up to the conference and every single workshop have been recorded. The plenaries in the week leading up to the conference are on the conference site, and they will be there permanently. So anytime you want to watch any of those, you can just go back to that day and open it up and you can watch the video there. The workshops are going to take about a week for us to get up onto YouTube because they start recording like way before the workshop actually starts, and we're going to have to edit it down a little bit. But we'll have all that stuff up in about a week, and we will email every single conference attendee with the links to where you find all of the recordings. So if you missed any workshops that you were really interested in, don't worry, you will get to access every single one of them after the conference ends. So that was one. Another quick note is that you can actually, when you're logged into SCED, the conference site, you can sort of evaluate and leave comments on every single workshop and every single plenary if you're interested in it. So if there's any particular, Garrett's giving us a hard time about taking a week to get stuff up onto YouTube. So if there's any particular workshops that you appreciated, that you liked, show them some love, leave them some comments on SCED. If you have constructive feedback for any workshops or any plenaries, then we welcome critical feedback as well. And yeah, so that's the logistics stuff. But we wanted to, one of the big things we wanted to do in the closing plenary is to just kind of sum up the big takeaways from the conference. So Gillian, how are we going to do that?
How are we going to do it, Ben? I was thinking, so we were thinking about takeaways. And when we say takeaways, we really mean like, what were some of the kind of broad themes that are going to stick with us throughout this, throughout our work over the next year until we come back together again at the conference next year. So just in terms, we were wondering about, how all of you were feeling about that, and kind of what your takeaways. So if you want to take a second just to type in the chat what what you thought were some of the important common themes that we can all take away from the conference. Norm says, takeaway, together we will win. Thank you, Bill Farmer. Thank you so much for your work. That's great.
Yeah, I'd be interested if there's something new you learned at the conference, something that's going to help you in your organizing work going into this next year.
Building people, more power. Oh, this is great. Medicare para todos for Spanish speakers and Latinx community is important.
I'm so glad you went to that one, Stephanie.
Yeah,
that's one I have to go back and watch because unfortunately we don't get to attend any of these workshops organizing the conference. It's like, man, we really want to, that's going to be so important for us to win this. So
absolutely. Let's see, takeaways for me, says Wes, were a couple new connections and plans to keep talking and planning about how we will work together, or will work in Oregon and New York. Fantastic. Oh, and we have a shout out to the workshop on VA, the VA and Medicare for All.
Yep. I'm noticing a lot of focus on growth. George says plan to contact 800,000 people. That's the kind of big thinking outreach we need. Beth had said earlier, we need power in numbers.
Terry says it's important to hire bicultural organizers. That is really cool.
Sorry, I'm way behind everyone's comments scrolling down here. So
And then I think the last comment is great. Zenny says, intense grassroots organizing always works. I love that.
And Gay had not heard of deep canvassing, but found it really useful. Yeah, deep canvassing is to me, it's just like good organizing. Actually talking to people and listening to them instead of giving them pitches and talking at them and over them. But it's been really transformative for, I think, a lot of movements in the last few years. So
I would strongly recommend, if you're interested in more about deep canvassing, that you check out our podcast episode about deep canvassing, which is from a couple months ago.
Mm-hmm.
This is great. So, you know, we had our own kind of takeaways from this and really kind of hit on most of them.
Yeah.
I mean, I think the most important thing was that this has been a conference that has been really focused on organizing. You know, it's really easy in our movement to kind of get stuck in internal kind of policy debates and really end up talking to each other. But it seems like so many folks at this conference are out of that mode and into connecting with other people mode. And I love that, because it means our movement isn't going to shy away from one of our greatest challenges, which is growing in the next year.
Mm-hmm. And I've just noticed a theme. This is like really big picture theme from all your comments. Almost all of your comments are focused on organizing. And that may sound like duh, like we have to organize to win this, but I can tell you, having been in this movement for a long time, people sometimes get fixated on messaging. That we just, as if you can make the right argument and somehow that's going to help us win this or win it for us. So I really appreciated that the overwhelming content of the conference was about organizing. Almost all your takeaways were focused on organizing as well. That's how we like it, because that's how we're actually going to win this thing. So
absolutely.
Mm-hmm.
We also are, you know, we were also just really excited about the kind of like rich diversity of tactics and strategies that folks have been talking about this weekend. You know, Ben always says that one of the signs that our movement is maturing is when we have these kind of multi-pronged strategies, a diversity of tactics, right? There are folks here who are doing things like mutual aid, and then there are folks here who are, you know, working on the federal fight or the state fight or municipal resolutions, or you know, I mean, this is like a really this is a group of folks who have lots of different ideas, and the healthcare industry is really complicated, so we need to have a complex approach to taking it down. So I love seeing the fact that everyone here is attacking the healthcare industry from all different directions.
Yeah, I think the last thing I wanted to shout out, which is reflected in a few of the comments too, is, you know, this conference is co-sponsored by Healthcare Now. We're kind of the community organizing wing of the movement, mostly patients, people who have been directly impacted by the healthcare system. But we co-sponsor the conference with the Labor Campaign for Single Payer, which is primarily focused on sort of the organized labor movement. And I think most of us feel that organized labor has to kind of be in the lead for us to win this, has to take a really central role and dedicate a lot of, really prioritize winning this Medicare for All fight. And it's becoming existential for so many unions. So those workshops that folks shouted out that the UE did on bringing Medicare for All into the workplace, that's something that like the UE does better than most unions I know, actually bringing Medicare for All to the bargaining table. I remember when they went after GE, like GE was trying to cut healthcare benefits for their workers, and GE actually is a huge medical device manufacturer. So they are making money off of the high healthcare costs that then they're complaining about and use those complaints to try and slash their workers' healthcare benefits. So UE has been so powerful at doing that. And then also Cindy Young's great workshop on taking healthcare off the books. And sorry, someone said UE, United Electrical Workers, who've been a great big part of this conference.
Yeah, absolutely. Absolutely. Also, I just want to shout out Rita, you were saying in the chat, Rita Valenti, one of our amazing board members. Rita was saying that we have a long way to go in terms of bringing, people of color and other marginalized communities into the fight. And I just want to underline that because that's something that I think we all really need to challenge ourselves to work on in the next year.
Absolutely. So we're gonna keep this closing plenary pretty short. We're not gonna keep you here for a long time. So one thing we wanted to do was to talk about this healthcare census 2022 campaign that Healthcare Now is going to launch. We've just been talking about this whole time. A big part of the conference is that our movement has to grow in order to have any chance of winning. But a lot of what we do, a lot of our work is not focused on growing the movement. A lot of it is focused on throwing our existing activists at legislators. We have to focus on growing. This is, the People's Action campaign. This is also the Healthcare Now campaign. And I think this is true in districts where we don't have a co-sponsor yet in Congress. Obviously, in most of those situations, we just don't have enough people power. We don't have enough activists. We don't have enough residents to mobilize and really move those legislators. But if I'm being totally honest, I think this is also the case in districts where we have a co-sponsor in Congress. I just want you to envision the day when we're about to have a vote on Medicare for all on the floor in Congress. Think about how much money is going to be thrown at these elected officials. Think about all the TV ads that are going to be running in their district. Think about all of the healthcare industry in their district that's going to be turning out lobbyists, and just everyday staff people saying that, oh, I'm going to lose my job if we move to Medicare for all. Just envision all that pressure that's going to be applied even to progressive legislators, and think how big our movement has to be, even in those districts where we have a co-sponsor, to keep them as co-sponsors when it comes to that crucial vote. And I feel like every single one of our districts needs to grow. We're not strong enough or powerful enough anywhere to get this past the finish line yet. So this is what the 2022 healthcare census campaign that we're launching in about a month is about. The only painstaking way to grow our movement, or any movement, is to talk with people who we don't know already and have conversations with them about healthcare. It sounds simple, and it is kind of simple in a way. You just have to repeat it over and over and over, thousands and thousands of times to turn this into a winning movement. So, Gillian, do you want to talk a little bit more about the healthcare census campaign?
Yeah, I mean, I also dropped in the chat the links to the sign up form, and also the link to our presentation from Friday. If y'all haven't gotten a chance to check it out, you definitely should. We give kind of background on, how we sort of arrived at this campaign there. But in general, like we've been saying, right, this campaign is a healthcare survey, and we're using it to ask people about their experiences with the healthcare system, really focused on the way that people understand the healthcare system, which is the things that they encounter in their daily lives. So at the end of the survey, after listening to them, we ask them if they support Medicare for all and if they'd like to get involved with the movement. This is a really good way to identify folks who have been the most impacted by the healthcare system, and to start building a relationship with them. Medicare all groups, sorry, it's been a long week. Medicare for all groups in New York and Maine and Pennsylvania, they've run very similar base building survey campaigns. So we're, borrowing that really effective outreach model. And shout out also to, I don't know if they're here, but to Yuling and Ursula from Campaign for New York Health, who met with us and helped us to develop our survey. So we are asking both organizations and individuals to join the 2022 healthcare census campaign. Basically, we will provide all the trainings and all the outreach materials that you need. If you're an individual, you can set your own outreach goal. Maybe that's to collect 10 surveys in the next few months. Maybe you set an ambitious goal of conducting 100 surveys over the rest of the year. Organizations that join the campaign are going to work with their own activists to do survey outreach, and we can customize the survey for your state if you're interested. So again, this is just supposed to be a tool that is useful to folks on the ground, and so we're interested in hearing about all the ways that y'all might use it.
Cool. And I just popped those sign up forms into the chat section.
Great.
I think the last thing we wanted to talk about about this campaign, you might be wondering about kind of COVID safety measures if we're doing a person-to-person outreach campaign. And, as you know, depending on where you are in the country, depending on your own medical background, this could be more or less, you might have more or less safety concerns about it. So I just wanted to say a few words about that. First, if you do feel comfortable doing limited in-person outreach outside, we're timing this with kind of the warm months of the year, at a farmer's market, for example, or at a public transportation hub, we would of course recommend that you mask and take other safety measures. But we are also recommending that people do not conduct the entire survey in person. Instead, we'd suggest that you have a sign-up sheet with you. If you're at a farmer's market, for example, maybe you have a table, a sign-up sheet, and people can schedule a time to conduct the survey with you by phone or by Zoom. So that way, we're not recommending at this stage that anyone have a long conversation face-to-face. And if, of course, based on your own medical situation or where you live, even that brief face-to-face interaction outdoor might not feel safe, you can still fully participate in the campaign by conducting only Zoom or only phone surveys. So you can obviously reach out to your network of friends and family to ask them to take the survey. That's what's called relational organizing, which, along with deep canvassing, relational organizing is kind of one of these important new developments in organizing focus and strategy recently. And if you don't have that kind of network to draw from on your own, we will help you identify folks who want to take the survey by phone or by Zoom. We'll email our lists. Hopefully the participating organizations will be emailing their lists in the state that you're in. So we are asking you to join this project of bringing 10,000 new people into the movement. That's the goal, build the movement by 10,000 new people. Since our number one priority is growing the movement, bringing in new people, identifying new leaders, and kind of developing the next generation of Medicare for All leaders who are going to take this past the finish line. So if you represent an organization and you'd like to join the healthcare census campaign, I popped that in the chat. Maybe Gillian can throw it in there one more time. And if you're an individual, you can also sign up just as an individual, even if you don't belong to an organization.
And for those of you who are asking, I'm sorry, someone asked if we can enable copy and paste in the chat. Ben has the child control locks on so that I can't deal with this stuff. But we also dropping these links again, and I'll remind you that we're going to be sending you later on in the week when we get back into the office, we'll be sending you a follow-up email which will have all those videos and the it'll have all those videos and also the links to sign up for the campaign. You won't be able to get away from this campaign in the next couple of months because we are going to contact you.
Yes. And some of you signed up even when you registered. So
yeah.
Do you want to do thank yous, Gillian, or as we're closing this conference out?
I always want to do thank yous. I am this was my first Healthcare Now conference, actually.
Oh, that's right. That's crazy.
Yeah.
It feels like you've been here forever.
I've been listening to Ben talk about this Healthcare Now conference for the past 10 years, and I finally got to experience it. And I am overwhelmed with gratitude for all the folks who made this possible. So basically, here's what we got. We wanted to thank, who do we want to thank? We want to take this opportunity to thank our live tech support crew, Kale, Carissa, and Emma Claire from New York TSA, who have been providing some badass tech support. We love you. Also, much love and gratitude to Anthony and his crew of tech experts who have been running the Zoom rooms this weekend. So Ben and I didn't have to, which is great. And of course, I want to shout out again all of our sponsors who gave money to make sure that folks who couldn't afford it could attend this conference, and that includes all the individuals who gave. I think there are 75 folks who donated to our scholarship fund, as well. Awesome. Yeah, super awesome. As well as our institutional sponsors, which include the Deb Jones Douglas Institute, National Nurses United, Minnesota Nurses Association, Physicians for a National Health Program, United Steelworkers, United Mine Workers, USW Local 675, Public Citizen, Healthcare for All Western North Carolina, Healthcare for All Minnesota, Mass Care, Single Payer Action Network Ohio, and Healthcare for All Oregon, and One Payer States. Really, again, so grateful for the kind of kind of rich variety of work that you bring, and thinking about Medicare for All that you bring to our movement every day. And most importantly, I want to thank all of you who have supported Healthcare Now over the past year, and some of you for many years now. This kind of gathering wouldn't be possible without a strong organization of dedicated activists. And really, that seems to be what you've helped us build here. And we're grateful for it.
Yep. And the last thing I'll say, I'm coming up on 10 years as staff at Healthcare Now. And before that, I worked for 7 years at MassCare, the Massachusetts single payer organization. And the reason I got into this movement actually was those many, 16, 17 years ago. My background originally actually was in labor education and labor research. I was at the School of Industrial and Labor Relations in upstate New York. But then I had a serious health issue. I came down with a panic disorder. I actually didn't know it was a panic disorder at the time. I would just kind of start shaking uncontrollably, and it would last for hours. I was misdiagnosed, actually. They thought it was a physical illness at first. But anyway, it got bad enough that I wasn't able to go to work anymore. It was just kind of totally crippling. So I was admitted to the hospital for a few days to get me stabilized. And I will never forget my doctor sitting me down when they finally discharged me after 3 days in the hospital. And he said, "I don't want you to panic. But your insurance company has said they're not going to cover your stay in the hospital." And I didn't panic until I got the bill for my hospital stay, which was over $4,000. And at that time, I was earning $14,000 a year. So to me, it might as well have been 4 million. And I, at a time when I really needed to kind of focus on my health and try to get better, I was immediately more worried about, was my life, were my finances for life going to be crippled? Could I fundraise through family and friend networks this much amount of money? I wasn't actually sure. After many years at Healthcare Now and MassCare, I know that my story isn't even close to the worst that our healthcare system inflicts, but it really hit me hard. I didn't know. I thought I had done everything right. I thought I had a job that had health insurance. I thought I was covered in the case that something happened. I didn't know that, I hadn't admitted myself to the hospital. My doctors admitted me. I was just following their advice the whole time. I had no idea I could end up with a life crippling, financial bill just based on that. But that's what, the American healthcare system does to people. So I decided I was going to change what I was doing with my life. I switched from doing labor organizing to trying to win a universal healthcare system. I never turned back, and I'm so grateful to be able to work with all of you who are also dealing with the horrors of the healthcare system in different aspects, in different ways. So if you're able to support Healthcare Now's work, I would just make one last appeal. If you can toss in a donation to Healthcare Now, it goes a long way. We're a small, mighty organization with only 2 staff people, but we have 60,000 activists around the country and a network of amazing local single payer organizations in almost every state. So your dollars go a really long way, and we will win this thing, I promise you. And thank you so much for attending the conference. We'd love to hear your feedback. And we're looking forward to the rest of 2022 organizing.
Thank you. I'm gonna drop that donate link just one more time. Just take a look at it.
All right. Thanks, everyone. We really appreciate your shout outs.
Yeah, thank you all so much. This has really been a beautiful weekend, and yeah, it's just been a pleasure to get to know some of you and to meet some of you for the first time.
And we will now release you on good behavior. And we'll talk to all of you soon as we get back to organizing. Take care, everyone. Bye-bye.
FYI, we're taking the next 2 days off, so don't try to get in touch with us.
Right, yeah. Leave us alone for at least until Wednesday.
All right.